Hola, hola, queridos amigos, muy buenos días. Gracias por estar con nosotros en su programa Café con Leche, la voz de los latinos en América. Estamos transmitiendo desde hermosa 1470 AM, 96.9 FM y también aquí en Facebook Live. Gracias por estar con nosotros el día de hoy. Bueno, tengo en el teléfono a Michael Dutton, que es mi co-host, y el día de hoy tenemos la fortuna de tener al doctor David Bronstein. Él es un doctor que es especialista en enfermedades infecciosas y por supuesto vamos a hablar del COVID. Él trabaja para Kaiser Permanente. Good morning, Dr. Bronstein. How are you?
I'm good, thank you. Good morning.
Good morning. Welcome back. Michael, do you want to start with the first question?
Well, yes, I would. Dr. Bronstein, what do you do at Kaiser?
So I'm a pediatric infectious disease specialist. So in addition to that, I also see general pediatric patients. So I have a panel of kids that I see and that I'm responsible for, but I also see kids who have infectious disease issues as well. And so I'll see kids in clinic or in the hospital, as needed if they're more complicated.
El doctor le preguntó a Michael qué es lo que hace en Kaiser. Dice que es un doctor de infecciones pediátricas, de enfermedades de infecciones pediátricas. Trabaja tanto en el nivel clínico, o sea, cuando ve al paciente solamente en la clínica, como en el nivel de hospitalización, cuando el paciente requiere más atención. Doctor, the Omicron variant has spread in the past month. Can you tell us how we in the Antelope Valley are doing with cases?
So there's still a lot of Omicron out there. I know it feels like it has peaked, where we've already seen the maximum number of cases per day, and now we're starting to see fewer and fewer per day, and fewer people who are testing positive. But I don't want anyone to think that it's over, because we are still seeing quite a few cases. I know when I see my patients who get tested, a lot of kids who are getting tested, still a good number of those kids are coming back positive. So there's still a lot of infection out there across the country, but also locally in the Antelope Valley.
Bueno, le estaba yo preguntando, la variante de Omicron se ha extendido en el mes pasado. ¿Podría usted decirnos qué está pasando en los casos aquí del Valle del Antílope? ¿Cómo están los casos? Dice, bueno, pues como hemos visto de Omicron mucho, dice, y afortunadamente alcanzamos el pico y cada vez se ven menos casos, menos también resultados que resultan positivos, pero todavía no se acaba esta situación. Todavía hay algunos casos que resultan positivos y tenemos que estar cuidadosos todavía, no bajar la guardia. Doctor, like how many children do you have? Have you seen more frequency in children that have not get vaccinated? I was listening yesterday that only 30% of children between 5 and 12 years old have been vaccinated. Is that right?
That's absolutely right, and it's really unfortunate. We have a vaccine that's very, very safe in that age group, and it works really well. And unfortunately, not enough parents are getting their kids out there to protect them with the vaccine. In the older age group, in the 12 through 17 age group, where the vaccine's been available longer, we actually do have significantly higher rates of vaccination, which is good. Although there's still room for improvement there too, but we really do need to make sure that we're protecting the younger ones. There have been studies that have shown that among kids who are hospitalized because they have severe cases of COVID and the complications that COVID can cause, among those patients, among those kids, 99% of the kids in the hospital with COVID were not vaccinated. Okay, and so it just shows you that the vaccine is very good at protecting not just against getting infected, because you could still have a mild cold if you get COVID and you have the vaccine, but you almost definitely won't go on to have more severe complications like pneumonias or other things that put even kids in the hospital too often.
Bueno, estamos hablando, le preguntaba yo ayer cómo está la situación con los niños. Le digo que el día de ayer oí en las noticias que solamente 30% de los niños entre las edades de 5 a 12 se han vacunado. Es un porcentaje muy, muy bajo. Esto, dice, sí, desafortunadamente no hay suficientes niños o suficientes padres que hayan llevado a sus niños a vacunar. Dice, aunque en el grupo de los niños de 12 a 17 se han notado un incremento, todavía en los niños más pequeños no. Y bueno, quiero decirle que los niños que han sido hospitalizados, 99% de los niños que llegan al hospital no se han vacunado. Y dice, aunque con la vacuna no quiere decir que van a quedar sin ningún problema, es posible que tengan solamente un resfriado ligero, pero cuando se desarrolla una neumonía es cuando tienen que ir al hospital y son los niños que no se han vacunado. Ojalá que tomen cartas en el asunto y se vacunen de inmediato. Okay, Michael, now it's your turn. I'm sorry that I did
No,
this.
that's quite okay. Doctor, I'm curious about one thing, and because there seems to be a small pushback, some anti-vax parents and some no-mask parents coming to school boards and protesting. What say you about that in the protection of children?
Yeah, no, that's a great question. And I think right now we have two different issues. We have the folks who are, like you said, anti-vaccine or anti-mask. That's one thing, and that gets into the political world. And I mean, obviously, as a physician, I don't agree with that. I think the most important thing we can do to keep kids safe is to protect them from getting severe infections in the first place, which is what the vaccine is for, but also to have them wear masks, especially when they're indoors, to prevent spreading the virus person to person. And that's been shown to work in any scientific study that you can look at. Masks are effective, vaccines are effective. So the science is completely against those views. The other thing, though, which to me is the most important thing to talk about, are the parents out there who just need a little bit more information in order to be comfortable to protect their kids with the vaccine. Who aren't anti-vaccine, their kids have all their other vaccines, but they just need a little bit more information to understand why it is so important. And you know, hopefully that's something that I can help provide, and if not me, talk to your child's pediatrician, who can definitely give you some good information about how to protect the children here.
Michael Dotton estaba comentando acerca de cómo ahora en las mesas directivas, en las juntas de las mesas directivas de las escuelas, algunos padres que están en contra de las vacunas y en contra del uso de las máscaras han ido a protestar. Dice, ¿qué les dices a estos padres? Dice, bueno, definitivamente hay grupos que son antivacuna y antimáscara, y esta es una cuestión política, dice, pero yo creo que hay que proteger a los niños porque de casos severos, y para eso se debe de usar la máscara. Yo los invito a que usen la máscara porque es la única manera que se pueden proteger de los contagios. Dice, pero sin duda alguna también hay otro grupo de padres que todavía necesitan un poco más de información para sentirse cómodos y llevar a sus niños a vacunar. Espero que yo los pueda ayudar con eso y para que puedan entender la importancia de vacunarse. Doctor, then what would you tell to a parent who still is not convinced? What do you tell them?
Right. So, you know, and I love having these conversations with people, and I do it every day. Whenever a child comes in who hasn't yet had the vaccine, and again, these are kids who get every other vaccine. You know, the parents protect them with all the vaccines required for school. They protect them with their flu shot every year. And yet with this one, they need a little more information. And so first thing I do as a pediatrician is I ask, what are your concerns? What have you heard that is making you a little uncertain or uncomfortable? Why have you waited and you know, till you can talk to me about it? And then they'll tell me. And the most common concern that I hear is the concern over, can there be long-term effects from the vaccine? You know, this is a relatively new vaccine. We haven't used this specific one before. Is it possible that if we give the shot now, will there be complications 10 years from now that we just don't know about? And to that, I tell parents, that does not happen with vaccines. That does not happen at all. Ever since the first vaccine we had against smallpox 200 years ago, we do not ever see long-term effects with vaccines because that's not how they work. The way vaccines work is they give you long-lasting immunity. They give you antibodies against disease so that you have long-lasting protection. But the vaccine itself, that your body chews it up right away. It disappears. It's no longer there. It doesn't integrate into your genetic code. It doesn't have any long-lasting effects. And theoretically, when you look at the science behind vaccines, that's not something that's even possible. So even though a lot of people think, could it be possible, it's important for me and all my colleagues to reassure them that that is not something that we're even remotely worried about when it comes to vaccines.
Perfect. Le preguntaba yo al doctor, bueno doctor, ¿y qué le dice a los padres que están en esa situación, que quieren más información acerca de la vacuna? Dice, bueno, primero lo primero que les digo es que definitivamente ellos siempre están preocupados. ¿Cuál es su preocupación? Dice, generalmente vienen con la preocupación de que no saben exactamente qué va a pasar, que ellos no se sienten cómodos porque creen que pueden haber efectos de largo término, haz de cuenta como efectos secundarios que salgan después de algunos años. Y dice el doctor, eso no ha pasado con ninguna vacuna. Desde que se inventaron las vacunas, nunca ha habido un efecto secundario de la vacuna, porque lo que las vacunas hacen es solamente crear inmunidad en contra de los virus o de los virus que están atacando. Eso es simple y sencillamente se crea inmunidad. El cuerpo empieza a reconocer cuál es el problema y a atacar eso, pero no ha habido absolutamente ningún efecto secundario nunca en lo que respecta a las vacunas. Así es que de eso pueden estar absolutamente tranquilos e irse a vacunar. And doctor, when they go to you is because the child is already sick. Is that right?
I'm sorry, can you repeat that?
Yeah, that when you talk with the parents is because already the child is already sick, or is in advance.
So most of the patients that I see, most of what I do is actually more of the general pediatrics. So I see a lot of kids who are on my panel that I'm responsible for, and they come in just for their well child visits and simple needs like that. So for those parents, a lot of the times they come in and they just want more information before they decide to get the vaccine, and then we take care of it. But you're right, I do see kids who are very sick. And to me, that's always the tragedy, right? The tragedy is that we have a vaccine that's very effective at preventing kids from getting very sick, and yet because we're not protecting enough kids with it, we are seeing kids who come in who have either, pneumonia and wind up in the hospital, or recently I've been seeing a good number of kids who have fever for several days because they have COVID and they just aren't able to fight it off quick enough or well enough, and these poor kids are miserable for many, many days, and we wind up having to do all sorts of lab tests and other things that definitely aren't fun to do in order to assure that they're okay and they don't have any of those COVID complications. But in each of those cases, when I see kids that are very sick, to me it bothers me because I know in my heart that was absolutely preventable. And, the parents could have done something to protect these children, and yet it wasn't done. And I don't blame the parents because I know there's so much misinformation out there. Mm-hmm. I blame all of us who are trying to spread the word, and we're just not able to spread the word effectively or as widespread as we need to get people comfortable with their decision to protect their kids.
Bueno, estamos hablando, amigos, de cómo los niños, le digo que si él cuando los ve ya están enfermos, ya lo van a ver porque el niño está enfermo y porque no tuvo la vacuna. Dice, no, yo también tengo una práctica de pediatría general, así es que veo niños que vienen a visitarme para checarse en su estado general, ¿no? De ver cómo están creciendo, todo bien. Dice, pero también veo niños que ya vienen con una neumonía, con fiebre, y que han estado sufriendo por muchos días por el COVID. Dice, eso me rompe el corazón porque definitivamente hay la posibilidad de que esos niños no hubieran tenido que sufrir eso. Así es que si ustedes, mamá o abuela, dice, me da pena porque quiere decir que no hemos sabido convencerlos de que se pongan la vacuna. Ojalá que esta conversación sirva para que muchos padres y abuelos tomen de inmediato la iniciativa de llevar a vacunar a sus hijos. Doctor, we are going to take a break and we will be back.
Sounds good.
El abogado Ángelo Campano ya ha sido elegido 3 veces como el mejor abogado del Valle del Antílope, así que si sales lastimado en cualquier tipo de accidente, solo llámale al 661-945-5300 y él ganará tu caso. Y si no gana, no le debes nada. No esperes más, 661-945-5300, 661-945-5300, Ángelo Campano, el abogado en quien la comunidad confía. Hola, hola amigos, buenos días, gracias por estar con nosotros. Para los que no han escuchado, tenemos al doctor David Bronstein de Kaiser Permanente. Él es un médico que trabaja con niños en enfermedades infecciosas, así es que estamos hablando de la vacuna del COVID y la necesidad de que todos los niños de 5 hasta los años que tengan se vacunen de inmediato para que evitar que puedan sufrir estas enfermedades que están llegando los niños al hospital porque son los que no están protegidos. Michael, do you want to make a question now?
Well, I had already asked the one about the mask and getting vaccinated, but one thing I think that the general public needs to know is that you don't have to be a Kaiser member to get your vaccine shots from Kaiser. And they have a location at the fairgrounds where you make your appointment and you can get in there and just get your vaccinations very quickly. And I just wanted the doctor to ask this one question, and that is, we're in that season where flu is going around as well, and we don't know, you got the vaccine, you have the flu, da-da-da. Should you get your flu shot as well?
Absolutely. No question, the flu shot is very important as well. Last year, somehow we didn't see any flu. Flu just disappeared for a season. And so I think a lot of people got this false sense of security that, flu is gone, we don't have to worry about flu. But unfortunately, it is back this year. And we have seen a good number of cases of flu in addition to COVID. And they're both going around at the same time. So definitely a great idea to get the flu vaccine in addition to the COVID shot. And you can actually do those both at the same time. So if you're coming in for your COVID booster or your primary series, you can get the flu shot with that as well. It's totally fine to get both vaccines together, and it's actually recommended to do so. Very important, though, because flu itself is dangerous. God knows over the years I've seen way too many kids winding up in the hospital or worse because of influenza infections that also are very preventable with the vaccine. But in addition, flu causes confusion right now, and everyone's worried about getting COVID, and you have to isolate and spend all this time away from work and away from the people you care about who you don't want to infect. Well, it's very confusing if you have symptoms of the flu that look just like COVID, and you don't know if you have COVID or not, and it just can be very, very confusing and distressing for people if they get sick with flu-like symptoms for any reason. So the more you can protect yourself against any of these illnesses, the better off you're going to be.
Wow.
Very good.
Bueno, Michael,
Now,
let me
a follow-up question.
Michael, but let me translate before I forget.
Go ahead.
Okay, Michael estaba comentando que ahora no necesita ser miembro de Kaiser para poder recibir la vacuna, tanto del COVID como de la gripe, y tienes que ir ahí a los terrenos de la feria donde se te va a aplicar. Estábamos hablando y le preguntaba a Michael, ¿es necesario ahorita aplicarse también la vacuna para el resfriado, para la gripe, dice, por supuesto. Dice, el año pasado no tuvimos ningún caso, muy pocos casos de la gripe, pensamos que ya se había ido, pero este año regresó y hay mucha gente que está muy preocupada porque ahora están confundidos, no saben si es su gripe. Dice, también hemos tenido casos extremos de niños con gripe que también terminan yendo al hospital. Dice, pero entonces no sabemos, las familias están confundidas que es COVID o es la flu, y entonces es una verdadera tragedia. Pero la buena noticia es que se pueden vacunar para las dos y así se quitan de preocupaciones. Doctor, I would ask you, Michael, okay, you want to continue? Go ahead.
Yeah, I wanted to follow up and just ask if when people walk in at the fairgrounds and get their COVID shot, can they also get a flu shot there?
So definitely for Kaiser Permanente members, they can get their flu shot at the same time.
Okay.
I honestly am not positive in terms of non-members if that's the case, and I don't want to overpromise here. So definitely we'll get you hooked up with the COVID vaccine, but worst case, if it's not something we can do with flu shots available everywhere, and most of those places do take any of the other insurances out there.
Bueno,
Okay,
la pregunta era si en la feria las personas pueden recibir las dos vacunas, las del COVID y las del flu, pero dice, bueno, yo tengo entendido que la del COVID sí para todos, pero la del flu tienes que ser miembro de Kaiser. Pero dice, no les quiero prometer nada, no estoy absolutamente seguro, pero lo que sí les puedo decir es que hay vacuna de la flu disponible en muchas áreas donde toman cualquier tipo de seguro médico para que los vacunen. Así es que, doctor, and now I hear that they are going to approve the vaccine for children 2 months and older. It was for approval, I believe, in these days. Do you know something about it?
Right, so that's the hope, actually. So right now the Pfizer just filed with the FDA for emergency use authorization for the vaccine for children at 6 months of age through 4 years of age. So we've got into the less than 5-year-olds now. That they're going to have a discussion at an upcoming FDA advisory committee meeting on, I believe, February 15th. And then from there, if it's approved, then the CDC will have their meeting and see if it's recommended. And then shortly after, hopefully by the end of this month, we may have a vaccine for kids 6 months of age through 4 years of age as well, which to me is really encouraging, because especially for those kids who are infants, the 6 months and up, we do see COVID in them, and it's often more complicated than just your typical cold-like symptoms. So being able to protect them with the vaccine is really a tremendous step forward.
Bueno, nos está hablando de la compañía Pfizer, que está aplicando las vacunas para los niños, que pidió una autorización a Food and Drugs Administration para una vacuna que va a ir de los 6 meses a los 4 años, para proteger a niños de 6 a 4 años. Esta va a estar probablemente en el febrero 15, se va a dar la decisión, y es posible que ya se pueda tener la vacuna, porque estos niños son los que están siendo más afectados con esto del COVID. Así es que es importantísimo. Doctor, but what is the case that we have vaccination for everybody, but they don't go and take the vaccine? What do we do?
Yeah, no, that is the challenge. That is absolutely the challenge. And again, that's why I'm here today. And that's why I spent so much time during all of my clinic visits talking to each and every parent who knows me, who trusts me, who will listen to me, and we can talk about their concerns and hopefully convince them, that it's a great idea to protect their children against the virus with the vaccine. And too often people are unfortunately feeling that they're somehow protecting their kids against the vaccine by not vaccinating them. But that's the wrong mindset. The illness is what we need to protect them against, not the vaccine, because the vaccine is safe and the vaccine is effective. One encouraging thing, which I'd love to mention on this program, is that we do look at the racial and ethnic breakdown of people who are getting the vaccine specifically within Kaiser Permanente, although you can extrapolate to the community. Mm-hmm. And unlike the national numbers, unlike probably even the state numbers, when we look at who's getting the vaccine more often, we actually, in the Antelope Valley for Kaiser Permanente, we have a higher percentage of our Latinx population who is vaccinated than any of our other racial and ethnic groups, with the exception of the Asian population, which is significantly smaller. But when you compare to white members, for example, of Kaiser Permanente, our Latinx population has a higher rate of getting the vaccine, which I am so thrilled about, and I think that's something that we should all celebrate and continue to keep protecting ourselves here.
Bueno, le estaba yo comentando de que qué bueno que se están aprobando ahora vacunas para niños tan chiquitos como 6 meses hasta los 4 años. Pero, ¿de qué sirve si no se están aplicando las vacunas? ¿De qué sirve? Dice, sí, definitivamente yo siento la misma preocupación, pero lo que sí les quiero decir es que todos los días cuando estoy en mi práctica estoy tratando de promover que los niños se vacunen para que puedan estar saludables y no tengan que sufrir miserablemente el COVID. Pero además, dice, revisando las estadísticas de Kaiser Permanente, dice, porque nosotros llevamos estadísticas, y dice, y en contraposición a todo lo que sucede a nivel estatal e incluso a nivel del país, aquí la comunidad latina es la que ya tiene el más alto porcentaje de vacunación, dice, lo que me da mucho gusto. Doctor, could be possible that is because we are too many Latinos already living in the Antelope Valley?
Yeah, I mean, there's definitely a large number, but what I look at is not just the overall number of vaccines, but what we refer to as the penetration rate. So what percentage of that large number is getting the vaccine, and a larger percentage of Latinos are getting the vaccine than the percentage in other groups. So it's definitely more vaccines given, but also a higher percentage of people, a higher percentage of Latinos are protecting themselves than the other racial and ethnic groups, which is really encouraging. And honestly, I think it is a tribute to the work that you've been doing, spreading good information and making people comfortable with the vaccine.
Qué bueno, I'm so glad. Mira, nos acaba de hablar de un término estadístico, dice, no solamente se juzgan la participación por el número de personas, porque le preguntaba yo, ¿será posible que somos los que hemos estado más vacunados porque somos la población más grande? Dice, no, es que estoy hablando de la tasa de penetración, o sea, son operaciones estadísticas que se hacen más específicas para comparar el número de la población y el número de vacunados, pero con otros aspectos. Dice, y estoy tan orgulloso de eso. Ojalá que sea el doctor que nos viene aquí a explicar por qué es tan importante su contribución para que todas las personas, los abuelos, las mamás, de inmediato lleven a vacunar a sus niños de 5 y más, y esperamos muy pronto de 6 meses en adelante para que podamos estar todos saludables. ¿Qué necesidad de estar sufriendo? Doctor, I hear so many cases of people who die, Hispanics that died with the COVID just because they didn't want to use the vaccine, and it was so I can understand that kind of decision. They were seeing everybody around dying, and still, oh no, that is not going to happen to me. So sad, eh?
Absolutely. It's so tragic now because it's preventable. In the beginning of the pandemic, there were lots of reasons for people getting sick, people passing away. Absolutely a number of reasons why that would happen, and why it would happen disproportionately to Latinos, for example. But now that we have a vaccine that's readily available, that's free, that's easily accessible, there is no reason for anybody else to be in the hospital or pass away from this disease that we can now prevent. So
Doctor,
we just need to keep encouraging more and more people to get it.
I'm so sorry, but I have to go. I will translate tomorrow, I promise. Thank you so much. Hasta la vista, Michael. Thank you so much. Bye-bye. Nos vemos, amigos.
Thank you, Doctor.
No problem. Thank you so much. I really appreciate it.
Adiós.